start the spotting of the lower limb, first we identify the thumb and the little toe. So this is the big toe, and over here this all of it will be the medial side, and that side will be the little toe. In the lower part we see the little toe, and in the upper part we try to identify the fasciolata, the iliotibial tract. So this is the iliotibial tract. This is the anterior side because the nails are present on the anterior side. So this is the anterior side with the iliotibial tract present laterally. In the iliotibial tract, the fibers that enter anteriorly are the fibers of tensor fasciolata, and in the posterior aspect the fibers that enter are of gluteus maximus. They are reflecting the tensor fasciolata, reflecting the iliotibial tract. What we can see is that these are the muscles of the anterior compartment, the quadriceps femoris muscles. These are the flexors of the hip and extensors of the knee. So this is the rectus femoris, bipennate muscle. This is the rectus femoris. This is towards the lateral side, little toe. This is the vastus lateralis, and vastus lateralis is covered on the lateral side by the iliotibial tract. So vastus lateralis, vastus medialis over here, and reflecting it below, this is the vastus intermedius. This is the nerve of vastus intermedius. All right, now I have moved the limb so that I can see the head of the femur with the fovea, with the ligament of the head of femur, and I can see the big toe. So over here we see this long strap muscle which is called sartorius, reflecting the sartorius. We can see the adductor canal in the lower part and the femoral triangle in the upper part. In the upper part, the femoral triangle, the boundaries of the femoral triangle are formed medially, or the floor of the femoral triangle is formed medially by the pectineus and the iliopsoas muscle. And so this muscle over here towards the medial side is the iliopsoas, and this muscle over here is the pectineus. All of it is pectineus. This is pectineus, this is iliopsoas, and between them are the femoral nerve, femoral artery, and femoral vein. How they are present is that the femoral artery is present between the femoral vein and nerve. Femoral nerve is the most medial structure. Over here it will be the femoral vein is the most medial structure, then artery, and then the nerve, which comes in a separate compartment with the iliopsoas muscle. So the boundaries of the triangle were formed by this femoral triangle were formed by sartorius and adductor longus. So these two muscles are going to form the boundaries, and at the apex of these boundaries, the femoral vessels, they enter the adductor hiatus. So we are reflecting this, we can see the iliopsoas and the pectineus. ठीक है जी. And the neurovasculature, if we look at the lumens, this thick lumen is of the artery, and this thin luminal vessel with clots in it, this is the vein. And as we said that the artery is lateral to the vein, and we can see the branches of the artery as well that are going between the iliopsoas and the sartorius. These are going towards the left lateral side, so they will be the ascending, transverse, and descending branches of the lateral circumflex femoral vessels. So they are going to go inwards. This was the femoral artery. Deep inside, this over here will be the profunda femoris along with the vena comitante. So it is entering into the femoral artery over here and giving off the lateral circumflex femoral artery. All right, moving more medially. we have these three adductors. I am going to put the sartorius over there, and this muscle is gracilis. So the gracilis over here, reflecting the gracilis, we can see the adductor magnus that was forming the boundary of the femoral triangle, the adductor brevis, this small muscle, and then this large muscle, the adductor longus, and this is the muscle. This is the neurovasculature that is passing through the adductor canal, and it is going to pass between the tendinous and the aponeurotic fibers of adductor magnus to reach the popliteal fossa in the posterior aspect. Now I have moved the specimen so that it is facing posteriorly. So this is the heel, and I have moved it so that it is facing posteriorly towards the medial side. There is the popliteal fossa is formed by the semitendinosus and semimembranosus. On the lateral side is the biceps. This is the long head of biceps, and this over here is the short head of biceps. The popliteal fossa gets the sciatic nerve. This is the sciatic nerve, which is dividing into tibial and common fibular branches. This is the popliteal vein, and below it is the popliteal artery. This popliteal artery is getting some of the is sending the branches, which will be the superior medial genicular, lateral genicular branches. Okay, coming towards the leg, we have this posterior aspect. We have this gastrocnemius, which is covered like this. This is the gastrocnemius, reflecting the gastrocnemius. This is soleus, putting it all upwards. This is the tendocalcaneum. This is the tendocalcaneum. In the deep parts of the posterior aspect, we have three muscles. The first muscle in the posterior aspect is the flexor compartment of the leg. So this is the first muscle that we can see in the leg, but it passes behind the tibialis posterior. So this muscle over here that originates from the tibia and passes behind the tibialis posterior, this is the flexor digitorum longus. This tibialis posterior tendon, it is coming from the deep muscle, the tibialis posterior, which originates from the ulna as well as the interosseous membrane and the radius. These are the posterior tibial artery and the tibial nerve, and this muscle is the flexor hallucis longus, which is going to pass most lateral structure. So over here tibialis posterior, then we have the flexor digitorum longus, then we have the posterior tibial artery, tibial nerve, and the most posterior structure is the flexor hallucis longus. On the lateral side, we have two muscles. The muscle that goes and attaches is going to groove the lateral malleolus is the peroneus brevis, and which is present farther apart, and the tendon is longer. This is peroneus longus. In the anterior compartment, this is the tibialis anterior over here. Then is the extensor digitorum longus, and between the tibialis anterior and the digitorum longus is the tendon of flexor hallucis longus. So tibialis anterior, flexor hallucis longus, flexor digitorum longus, and between them or in the deep parts is going to be the anterior tibial artery and anterior tibial nerve.